India is witnessing a massive surge in the number of blood cancer patients. Every 5 minutes, someone is diagnosed with blood cancer. Hi, I'm Dr. Lakshmi, and you're watching the Health Talk session by Yashoda Hospitals. So let's discuss and know more about blood cancer and its latest treatment modalities in our today's episode. Joining our discussion today is Dr. Ganesh Jaishetwar, consultant hemato-oncologist and bone marrow transplant physician from Yashoda Hospitals, High Tech City. Welcome to the program, Doctor.
Thank you.
Blood cancer is causing a significant health issue in our country. So to begin with, what is the burden of blood cancer in our country, Doctor?
Yes. So as you correctly pointed out, the incidence of all the blood cancers, not just, all cancers, not just blood cancer, is rapidly increasing across the globe. And so is the truth in India. So to be precise, going by the statistics, the Globocon 2022 survey, in India, about every 7 seconds, someone is getting diagnosed with blood cancer, and every 20 seconds, someone is dying of blood cancer. So such is the intensity of this particular issue across our population. So blood cancers normally constitute about 9 to 10% of overall cancer incidence. So in India, every year, about 80,000 new blood cancer cases are diagnosed. And coming back to our region, Telangana and nearing surrounding region, in the incidence of all the blood cancers, so there are 3 types of blood cancers: leukemia, lymphoma, myeloma. All these blood cancers put together, the incidence is about 5.5 to 6 cases per lakh population per year. So if you look at the population of Hyderabad, in Hyderabad itself, there are about 1,000 new blood cancer cases are diagnosed each year.
I think that's quite a number, Doctor. So what exactly is blood cancer and what are the different types of it?
So like other cancers, the cancers which originate from the blood system, so blood system or hematopoietic system is comprised of 2 organs: bone marrow, the production house for blood cells, as well as the lymphatic system. So these are the 2 components of blood system. So the cancers originating from this blood system, either from bone marrow or lymphoid system, are called as blood cancers. How blood cancers are different from solid cancers? Number 1, the blood cancers originate from the blood system, either bone marrow or lymphatic system. Number 2, the way the blood cancers spread across the body is different from the solid cancers. They originate from the blood system. Most of the blood cancers from the beginning are spread across the blood system. So particularly for leukemias and myeloma, which originate from the bone marrow, the staging doesn't actually carry any significance, whereas lymphoma, which originates from the lymph node or lymphatic system, staging does carry important significance for prognostication and treatment. Number 3, the treatment of blood cancers is different from solid cancers. Most of the blood cancers, vast majority of blood cancers are curable with chemotherapy or bone marrow transplant. So that is the reason why hematology and hemato-oncology, along with bone marrow transplant, is a distinct specialty apart from medical oncology dealing with all solid cancers.
So discussing about various types of blood cancer, Doctor, are there any significant risk factors or any particular age group which are affected more?
Yes, madam, this is important. There are certain blood cancers which are peculiarly common in certain age groups. For example, if you look at the childhood blood cancers, in children, a specific type of blood cancer called as acute lymphoblastic leukemia is very common below the age of 10 years. And vast majority of pediatric ALL is curable with chemotherapy alone to the tune of 80 to 90% cure rate with chemotherapy alone. Whereas certain blood cancers, for example, acute myeloid leukemia, is more common in middle-aged and elderly people. Third type of blood cancer, multiple myeloma, is peculiarly common in persons above the age of 50 or 60 years. And then lymphoma, again, there are two different types of lymphomas, Hodgkin's lymphoma, non-Hodgkin's lymphoma. Hodgkin's lymphoma in particular is common in young persons, either in the pediatric or childhood age group, or in young adults or adolescents between 20 to 40 years of age. Whereas non-Hodgkin's lymphoma as a group is common in people belonging to either middle age group or old age group between 40 to 60 or more than 60 years of age.
So as you've mentioned that blood cancer affects the entire hemopoietic system, are there any symptoms that you think we should be aware of or one should consult a physician for this?
Yes. So, vast majority of the blood cancers, simple blood test called as complete blood picture or complete hemogram. And based on the results of the simple blood test, you can devise further investigations to confirm the type of blood cancer. For example, for leukemia and multiple myeloma, bone marrow studies as well as certain blood tests. Whereas for lymphoma, imaging like CT scan of the whole body or whole body PET CT scan and the biopsy from the lymph node can establish the diagnosis of lymphoma.
I think that's important, how a simple blood test can detect a blood cancer. So discussing about blood cancer, what are the latest treatment modalities which are available for the patients one diagnosed, doctor?
Last 2 decades has seen a paradigm shift in the management of blood cancers. There are enormous, novel, most recent, most advanced treatments available for all types of blood cancers, which has not just improved the cure rate of blood cancers, but improved the quality of life of these blood cancer patients as well as the way they perform and live after successful treatment of blood cancers. For example, immunotherapy, targeted therapies. These kind of targeted and immunotherapies have made possible the treatment of blood cancers with very minimal side effects and with very good success rates. Along with this, there has been significant improvement in the outcome of bone marrow transplant or hematopoietic stem cell transplant. Now, we have advancement in the blood cancer treatment in the bone marrow transplant. So, we can do bone marrow transplant for every patient by availability of half HLA match family donors or international full HLA match donors. At Yashoda group of hospitals, we have performed more than 500 bone marrow transplant for patients ranging between 9 months to 72 years of age. We have done India's first successful double half match transplant thanks to advancement in the technology and the drugs available for blood cancer as well as bone marrow transplant treatment. We have done bone marrow transplant, the most complex advanced half match bone marrow transplant for people up to the age of 67, 68 years of age, and post successful half match transplant, these people in their late 70s, 3 years, 4 years, 5 years post transplant are completely leading a normal, healthy, happy life just like us.
I think that's incredible, and that's a significant advancement if we have to talk about treatment for blood cancer. So how do you think these patients can balance their lifestyle at the same time while undergoing these treatment protocols, doctor?
While undergoing treatment, they have to, it's a teamwork with all the caregivers, the blood cancer specialist and their team, and as well as the patients. So most important is to stay positive and focused in their treatment. So we keep on counseling these patients about the necessity of maintaining hygiene to protect themselves from the infections and sticking to the regular healthy balanced diet as well as maintaining a regular healthy lifestyle like regular exercises, collaborating with different patient support groups at Yashoda group of hospitals, Yashoda Hospital, High Tech City, regular discussions with the blood cancer specialist and their team. We have a comprehensive team in our department of hematology and bone marrow transplant with dietitians, psychiatric counselors, financial managers, care coordinators. So all of us work together to help these patients going through these kind of challenging and difficult treatment phases, which is not just challenging physically but mentally, emotionally, practically, financially. So we try to collaborate All our team try to collaborate with them, counsel them at various time points, make them stay focused and positive about the treatment, about the successful outcomes, about the positive outcomes. And that's the way they come out of this crisis.
So discussing about balancing and maintaining lifestyle, do you think are there any specific lifestyle modifications that you think we should take up that could positively impact our lives?
Absolutely. Just like for any disease-specific treatment, lifestyle modification carries a huge impact which strengthens the positive outcome of various treatment categories for blood cancers. The balanced and positive lifestyle like yoga, pranayam strengthens the patient's mental strength, their coping capacity, liaising with different patient support groups, close collaboration and constant communication with the blood cancer specialist team, the nurses, the blood cancer specialist, as well as the patient support groups, maintaining a regular balanced lifestyle like regular exercises, trying to maintain the weight, trying to maintain the high protein, high nutrient diet to cope up the muscle mass and to augment the response to various blood cancer directed therapies. These are the important lifestyle modifications.
So we've discussed that there is significant rise in the number of blood cancer patients diagnosed every year, but awareness about this is still not very much. So how do you think we should address this concern, doctor?
You have raised a very important issue, madam. I see a lot of curative or curable, completely curable blood cancer patients not coming out further for treatment because there is a myth across the society that like all other cancers, blood cancer also are not curable. Patients are going to be bedridden, bedbound for the rest of their lives. Even if they complete the successful treatment for blood cancers, they can never become normal again. This is the myth across the society. So we have blood cancer triumphants, survivors who have not just got cured themselves from the blood cancers, but they are transforming the lives of thousands and thousands of people across the society. One of my half-match bone marrow transplant survivor is a gym trainer. Nobody can believe that this person has some point of time has a deadly blood cancer and had got cured with half-match bone marrow transplant. Many of my patients, post successful treatment have pursued careers as doctors, as engineers, as lawyers, as software engineers, IT professionals, different professionals, and all of them are as equally healthy and equally productive as any normal person across the society can be. So we should have various, awareness campaigns, awareness programs across the society to convey the message that blood cancer, if treated properly with correct therapy at the hands of the correct doctor at a correct place and a correct time, vast majority of the blood cancers are curable.
So blood cancer can be a serious and life-threatening condition, but with the right treatment, the condition can be managed and most of us can live a normal life. So before we wrap this episode, doctor, what message you would like to give to our audience out there?
I will like to convey to all the, wonderful audience here that blood cancers are curable in vast majority of the patients. Number one, blood cancers are of three types: leukemia, lymphoma, myeloma. Number three, after successful treatment of these blood cancers, these blood cancer cured patients can lead a completely normal, healthy life. Number four, there are huge advancements in the treatments for blood cancers like immunotherapies, targeted therapies, different types of advanced complex bone marrow transplant. Because of the advent of these different therapies and advancements in the science, technology and techniques for the treatments of blood cancers, which are very much available at our doorsteps in Hyderabad at Yashoda Hospital, High-Tech City. Based on my 20 years experience, I will say blood cancers, blood disorders are not the end of the road. In fact, these blood cancers, blood disorders after successful treatment is new way of looking at life. So it is the beginning of a new wonderful journey with a new perspective.
So thank you, doctor. It was wonderful having you here on our program today.
Thank you.
So this brings us to the end of this episode. Hope this episode was informative on the topic blood cancer and its latest treatment modalities. And don't forget to join us for the next week as well. We at Yashoda Hospitals are more than happy to answer your health-related queries. Until next time, take care and stay healthy. Thank you.